And next, I wanted Cindy Norton to share, because her story kind of illustrates everything that we're trying to provide about naturopathic medicine. We all know that, obviously we love naturopathic medicine, but I wanted you to hear from a patient who's just really utilized our medicine and has a great story to share. And the more I'm over talking to the docs across the street, the more I realize they really don't know what we do, and there's a lot of still confusion about what we do and who we treat. So, Cindy, if you wouldn't mind sharing.
Hi, my name is Cindy Norton. I came to Dr. Bishop through my chiropractor. He's also a wellness chiropractor. He doesn't just snap and pop. He said I was having a lot of anxiety. It started after my 14-year-old was born, and was put on 2 different anxiety medications, gained a ton of weight, whereas, I asked my doctor, why am I gaining this weight? And he says, I don't know, I'm not a pharmacist. So that right there was, I was like, okay, there has to be something out there that can keep me informed and everyone else in my family who has the same issues. So I came to Dr. Bishop. We had kind of established a baseline. She, just by having me drink a shake, got me off of one of my anxiety medications within just a couple of weeks. Whereas when I tried to come off before, ended up in the emergency room. So that was one thing. The second thing was, I was at the long story short, because I could talk forever, about this woman and this facility. We were at the mall and started having a lot of pain. Thought I was having gas, took a Tums, kept getting worse. My 14-year-old got very scared. He called my husband, who works in North Dakota, and said, something's wrong with Mom. She's not looking well, and she's trying to be tough. They ended up calling the paramedics. They came, everything looked fantastic. They said, we don't know what's wrong with you, but we can certainly take you to the hospital. And dollar signs, came in my head as a mother and a wife, looking at all the bills. And I said, no, that's okay. I went to the hospital. I was there for about 3 hours, poked, prodded, everything under the sun, and they said, well, you're having an esophageal attack. That's all we can think of. Here you go. Here's some hydrocodone. Go home and see your doctor the next day. So what I love about Dr. Bishop is that I texted her and said, I am in a lot of pain. I just spent 3 hours there, and a bill that was $7,500 to tell me to go home with a painkiller. So I came in, she saw the discomfort I was in. She knew something was wrong after knowing me for just a short time, and got me in, I believe it was Dr. Zile's car, drove me across the street to get an emergency CT scan, and I had a 7mm stone lodged in my duct of my gallbladder. So the technician even said, after surgery, bring her back in. We'll do a rescan. Dr. Bishop, of course, okay. So we came back here, magnesium IV drip, and within an hour or so I was feeling much better, whereas I had taken 2 hydrocodones that night and still was not touching the pain. So she gave me some supplements, some black Spanish radish, which I had never heard of in my life. Do they sell that at Taco Bell? Because I don't think so. But so in the meantime, we had already paid for a trip to Florida with 2 teenage boys and had them very excited, and I was scared. My husband said, well, I hope you're feeling better. We'll call you from Florida if you're not ready to go. So I said, Dr. Bishop, we have to get me there. So 4 days later, after doing another magnesium drip, went back in, did another CT scan, no signs of any stones, no inflammation, nothing. Basically, I was cured. So we got it to pass, just by doing something. And I can't tell you the anxiety that I was having as someone who already has anxiety, thinking I'm going to have surgery. I had 2 children with no medication, not because I'm brave and strong, but because I was afraid of the needles. So for me, to think that I might have to have surgery was huge. The third thing that has just been recent, she called me and said, we just did your lab work because we wanted to get a baseline after all of that and after I was feeling better. By the way, Florida was fantastic. I did bring her a little sand bottle that says no stones, just sand. So fantastic. My husband was so elated that he sent her a big edible arrangement, like thank you for not letting me cancel this trip. The third thing real fast was we did a baseline on the blood work and everything and kind of did a workup, and she calls me and says, you're coming in today. I didn't think you could scare me any worse. My blood sugar was 236. I have diabetes on both sides of my family. She said, no wonder you're not feeling well, no wonder you're tired. What was the other thing that was wrong then? Oh, the C proteins were really high. We're still working on that. But, so I left here. She's like, you have to stop with the carbs. You have to, we have to change your diet. I was drinking 6 to 10 Dr. Peppers a day at 44 grams of carbs per Dr. Pepper, which now I know has 44 grams of carbs. I did not know that then. I just thought it tasted good. So anyway, again, long story short, I left here crying. I had to sit in my car for a while to compose myself because that's huge. I have teenage kids. It's easy to pop a Hot Pocket in the microwave. We have busy schedules, and I did not know how I was going to do that. I was raised on meat and potatoes and vegetables, and you eat everything on your plate because they are starving people. So anyway, I went on the internet when I got home, low carb diets. She had all these handouts, all this information. She texted me to check on me later. How are you feeling? Have you jumped off of the cliff yet? And I'm like, no, this is fine. I can do this. 7 days later, she had me come back in. My blood sugar was down 100 points, and I had lost 13 pounds. And got through the 7 days of my teenagers wanting to kill me because coming off of those carbs, for me anyway, was like coming off of crack. It was awful. I was moody. I was craving it. But, it's been 6 weeks now. My blood sugar's almost at normal, and I've lost 25 pounds. And I feel fantastic. And it's funny because I used to be a napper. Everybody in my family, all of my friends know that I'm a napper. Oh, Cindy's dozing over there. I haven't had a nap since I changed my diet. It's just fantastic. So I'm just grateful, for everything that they've done here. And my 14-year-old keeps asking when he can come back for acupuncture because he had a spider bite. We didn't know it was a spider bite. He thought it was a mosquito bite. It kept getting bigger. And so I just texted her. I said, hey, what do you think? It's got a little red thing coming out of it. She's like, bring him in. So she did acupuncture and then some bio-veg supplements, and within a day and a half, it was gone. And so the other day, I believe it was a mosquito bite that he had. He says, Mom, you need to call Dr. Bishop. I need some more acupuncture because I got a bite. He was just so excited that it was going to go away. So it's just nice. My husband, who I have to force him to go to the doctor because he doesn't like doctors. He has his own issues with that, but he has just been amazed with what she can do and what, just having an alternative, not having to go to the doctor. We were paying $1,200 a month for a family of 4 for our medical insurance, and they did not cover Keystone. They did not cover my chiropractor, who I see once a week. So we were wasting money. So we decided as a family to go to a major medical policy, which saves us $900 a month. And it kicks in for anything catastrophic after $5,000. So we're saving $900 a month because they don't recognize that, there are different things. It's go to the doctor, do this, do that, do what you're supposed to do. The I don't know if you want to say old-fashioned way, but, you don't have a choice. So as a family of 4, trying to raise teenage kids and pay bills and everything else, it was very upsetting to find out that the doctors I wanted to see were not covered through anything. So that's me. I'm good. I could talk for an hour, so thank you very much.